Not long ago, a magnetic compass was the only way to find a direction. Today, magnets have a wide spectrum of uses in electricity generation, MRI, spacecrafts, spacesuits, and other high-end technology used in the field of medicine. For ages, human beings have suffered debilitating diseases like osteoarthritis and life-threatening diseases like cancer, not knowing how to treat them. Osteoarthritis is a cartilage-related ailment associated with pricking pain and discomfort. It is a degenerative joint disorder which is caused by the breakdown and eventual loss of the cartilage of one or more weight-bearing joints. Cancer is a class of diseases in which a group of cells displays uncontrolled growth through division beyond normal limits. Invasion that intrudes upon and destroys adjacent tissues, and sometimes metastasis, in which the cancer cells spread to other locations in the body via lymph or blood. India has a very high percentage of osteoarthritic problems, leading to a loss of working days and productivity. Cancer is a deadly disease that has brought grief to many unsuspecting patients and their families. It is here that SPMF Healthcare and Research Center steps in, opening up new frontiers in the treatment of osteoarthritis and cancer. SPMF adopts the Sequentially Programmed Magnetic Field, or SPMF Therapy, the world's first scientifically proven non-surgical treatment that helps regenerate cartilage in arthritic knee joints and is proven to be extremely effective in the treatment of certain types of cancer. SPMF, with its advanced SPMF technology, has treated chronically ill patients successfully, besides instilling in them new hope, confidence, and determination to live longer in comfort and peace. Most osteoarthritic and terminally ill cancer patients can now hope for a new lease of life minus pain.
Over the last century, magnetic fields have been used in numerous therapeutic applications, but without significant success. Sequentially programmed magnetic field therapy has the capability to address the cells and cause changes in cell behavior, and is now the world's first scientifically proven method of treatment for arthritis and some types of cancer. The potential of this therapy is not limited to these two diseases. As we go ahead in our foray in research, we would find that it has the capacity to address other diseases which have been unconquerable in medicine, like Alzheimer's disease, diabetes mellitus, spinocerebellar degenerations, just to name a few.
SPMF addresses these issues. It creates highly complex, sequentially programmed magnetic fields focused on targeting tissues through magnetic field generators with pinpoint accuracy. The Actus Soma machine delivers these fields at field strength of less than 30 millitesla. These are non-thermal and non-ionizing. They have no side effects and are completely painless. The SPMF emissions are well below the norms laid down by the International Commission for Non-Ionizing Radiation Protection, ICNIRP. The main force behind the mission. In 2004, Wing Commander Dr. V.G. Vashishta, Professor and Head of Department Radiodiagnosis and Imaging at the Institute of Aerospace Medicine, Indian Air Force, began treating osteoarthritis patients through sequentially programmed magnetic fields. The pioneering effort by Wing Commander Dr. V.G. Vasishta, retired, Medicine, Indian Air Force, Bangalore, India, has made sequentially programmed magnetic field therapy one of the foremost non-invasive treatments for osteoarthritis and cancer.
About SPF, I had come to know through friends, but I was not convinced at all. How could it be? But later on, I came to a stage where I had to do something about my knees. Pain was very much. Then went through both the options. Then somebody said that if you go through knee replacement, you will have post-operative complications and all that. But SPF is non-invasive. There's no harm anyway, even if it doesn't affect you. So I've come back here, and this is my 4th day. I already feel a little better, say about 10% better in my knees movement. I'm very happy this. Let's see, another 24 days, I should be able to walk around straight. It's working well.
I heard about the SPF healthcare treatment for osteoarthritis of the knee, and I thought I should go for it because I was very keen on avoiding surgery. I went for the treatment. It was very non-invasive and simple and totally painless. I underwent treatment for a month with the lovely team of Dr. Vashisht and his helpful physiotherapists and other doctors, and the treatment was totally successful. I am now 100% fit, and I can walk for about 2 kilometers without a halt. Thanks to SPF Healthcare, I have had a new lease of life.
We at SPF Healthcare and Research are totally committed and dedicated to provide relief and improved quality of life to patients by using our sequentially programmed magnetic field therapy. We will strive to meet expectations, and all our actions will reflect that we are truly patient-friendly.
Kudos to SPF Healthcare. Kudos to SPMF Technology.